The Minneapolis church attack on August 27, 2025, highlights critical psychological, social, and institutional factors contributing to mass shootings. Understanding the shooter's profile and warning signs is essential for prevention. This incident underscores the need for comprehensive analysis to address the root causes and implement effective interventions. The Minneapolis church attack involved Westman, who used 3 legally obtained firearms to fire into a church during a school mass. 2 children were killed and 17 others, including elderly parishioners, were injured. The Federal Bureau of Investigation classified it as domestic terrorism and an anti-Catholic hate crime, highlighting the attack's severity. The Minneapolis church attack unfolded during a school mass, with Westman firing through stained glass windows using a rifle, shotgun, and pistol. Tragically, 2 children were killed, and 17 others, including elderly parishioners, were injured. The Federal Bureau of Investigation labelled it domestic terrorism and an anti-Catholic hate crime, highlighting its severity. Westman, who identified as female, had a personal connection to Annunciation Church through her mother. Her online presence revealed disturbing content, including weapon displays and a manifesto. This manifesto highlighted personal despair and external blame, common among mass shooters, with statements of self-hatred and acknowledgement of the impact of her actions. Westman's actions were influenced by a mix of personal despair and extremist ideologies. Video evidence revealed her use of white supremacist symbols and references to past mass shootings. Her arsenal bore names of mass killers and hateful messages. This case highlights how personal grievances can merge with extremist beliefs, fostering a dangerous mindset that justifies violence. Recent data indicates a decline in mass shootings in the United States. The Gun Violence Archive reports a drop from 659 incidents in 2023 to 499 in 2024, a 24% reduction. By July 2025, 268 incidents were recorded, suggesting this downward trend may persist, following a peak in 2021 with 693 incidents. School shootings have declined by 22.5% in the 2024-25 academic year, ending a 3-year rise. Education Week reports 8 incidents in 2025, down from 39 in 2024. The Minneapolis attack, the first of the new academic year, had the highest casualties since Uvalde in 2022, with the youngest victim being 8 years old. Mass shootings are predominantly committed by males, accounting for 97.7% of cases. The average age of perpetrators is 34, with a range from 11 to 70. Notably, 64.5% have prior criminal records and 62.8% have histories of violence. Westman, aged 23, exemplifies the elevated risk in the 17 to 24 age group. The racial composition of mass shooters mirrors United States demographics. 52.3% are white, 20.9% black, 8.1% Latino, and 6.4% Asian. This counters misconceptions, showing mass violence transcends racial boundaries, affecting diverse communities. Research challenges the notion that mental illness is the primary driver of mass violence. Only 9.6% of mass murders from 1900 to 2019 were motivated by psychosis. Instead, 57.86% stem from emotional responses to life circumstances like romantic rejection or workplace grievances. Effective prevention should address social isolation, conflict resolution, and emotional regulation beyond psychiatric intervention. Firearms have overtaken motor vehicle accidents as the leading cause of death for American children and adolescents since 2020. 7 children die from gun violence daily, with a 46% increase in firearm deaths among those aged 0 to 17 from 2019 to 2023. Black youth, only 14% of the population, accounted for 46% of these deaths in 2023. School shootings have reshaped American education, with 95% of public schools conducting lockdown drills. From 2020 to 2024, 51 per 100,000 school-aged children face school shootings, heightening suicide risk in affected communities. This normalization of violence preparation marks a significant shift in childhood experiences, uniquely impacting the United States educational landscape. Treating mass shootings as a public health epidemic involves evidence-based strategies. Key recommendations include restricting high-capacity magazines, implementing universal background checks, enhancing threat detection, supporting rapid medical response, and creating national data tracking systems. These measures aim to prevent incidents and minimize casualties, emphasizing a comprehensive approach to addressing this critical issue. Social isolation is a critical precursor to mass shootings, acting as a crisis multiplier that exacerbates psychological issues. Research on 177 shooters highlights the protective role of social connections. Community-based interventions promoting social connectedness could significantly mitigate mass violence risks, as evidenced by the Minneapolis shooters' increasing isolation and radicalization before the attack. Implementing trauma-informed disciplinary practices and fostering trust between students and educators are crucial. Behavioral threat assessment protocols help identify at-risk individuals early. Reporting systems are vital, as 75% of school shooters share their plans beforehand. Secure storage of firearms, with 4.6 million children in homes with guns, is essential to prevent access by potential perpetrators. State-level gun legislation significantly impacts youth firearm mortality. States with permissive laws saw 7,000 additional child deaths, while those with strict regulations, like California and New York, recorded notable reductions. Comprehensive gun safety laws are crucial in reducing pediatric gun deaths, as evidenced by protesters advocating for assault weapons bans and prevention measures. Westman's pre-attack YouTube videos highlight the trend of using social media to signal violent intentions. This raises concerns about copycat attacks and the spread of extremist ideologies. The challenge is balancing threat detection with privacy rights. Enhanced artificial intelligence and human moderation could improve monitoring, but their effectiveness in prevention is still under review. Community resilience plays a pivotal role in recovery post-Minneapolis shooting. Vigils and mutual aid offer emotional support, yet long-term recovery challenges persist, affecting trust and safety perceptions. Effective programs must tackle immediate trauma and broader social disruptions. Advocacy efforts like March for Our Lives highlight ongoing community-driven initiatives against gun violence. Classifying the Minneapolis attack as domestic terrorism and a hate crime allows for enhanced federal resources. Evidence shows state gun laws impact youth firearm mortality, highlighting the potential of legislative measures. However, political and constitutional challenges complicate implementation. Evidence-based policies focusing on weapon access, early warning systems, and community support offer promising solutions. The Minneapolis Church shooting highlights systemic failures enabling mass violence. Despite declining trends, numbers remain high, impacting children and communities of color. Evidence-based interventions on social connectedness and secure storage are crucial. Our goal, a society free from mass violence, requiring confronting gun culture and institutional failures.